Good afternoon and welcome, everyone. My name is Jose Melendres, and I am the Executive Director in the Office of Community Partnerships at the UNLV School of Public Health. And I am also the sitting chair for the Nevada Minority Health and Equity Coalition. And we welcome everyone who's joining us today for this webinar. As we all know, the COVID-19 continues to impact all of our communities. In today's focus is on the LGBTQI plus community and everything that's happening around the COVID-19, especially now that we are into the vaccine. The vaccine is out. People are slowly getting vaccinated as the vaccine becomes available. Today, joining us, we're going to have several folks, professionals from the public health field, professionals in the medical field, and community members who are joining us to talk from their perspectives, from their work, and everything that is going on around this. And so today we're hoping to share a lot of information, dispel some myths, and present some facts that will help our communities to work through this. Again, we want to stress that even though the vaccine is here, it is critical. Testing is still happening, and it's critical that folks continue to get tested where you need to, so that we can keep our community healthy, keep our community safe, and keep us moving in a good direction as vaccines slowly become available to more and more people. So with that being said, let me first thank our sponsors, who include the Nevada Minority Health and Equity Coalition, the UNLV School of Public Health, the Nevada Minority Health and Equity Office, Nevada Office of Minority Health and Equity, the Nevada Commission on Minority Affairs, and the Dreamsicle Kids Foundation. All are key parts of this effort and this movement as we move forward and continue to work on this. Also, I am so excited. He never says no to us and continues to be a great partner in these efforts as we move forward. And as I've learned, moderating, as we've all learned with this virtual reality, it's critical with these webinars to have a really strong moderator who can keep things moving, keep people engaged, and keep the conversation going and focused. And so with that, it is my honor to present our moderator for today, Mr. Will Rucker. Will passionately works to transform culture through compassion. He is an author, a speaker, a facilitator, and trainer, host of the Compassionate Las Vegas series that's been on. If you haven't seen that, please make it a point to catch one of those episodes. Will is engaged in local, statewide, and national platforms advancing social, spiritual transformation efforts in restorative justice, anti-racism, and humanity first initiatives. Currently, he works as the Health Promotions Division Director for the American Lung Association, Western Division, where he leads teams working to achieve health equity and trains professionals, volunteers, and organizations in health education. With that, Will, thank you for being here with us, and I will turn it over to you, sir.
Awesome. Thank you so much, Jose. It's an honor to be a part of this series and to share with each of you. For all of our amazing panelists, thank you for joining this presentation today. I cannot wait to hear what you're going to share with us. And to the audience, thank you for joining the conversation. Today, especially, I encourage you to pay attention and submit your questions. Any question that comes to mind, please submit it. You have experts here who are eager to answer. So on today's panel, you will hear presentations from 5 speakers who will share insights and expertise. Dr. Brian Labus, Assistant Professor at the UNLV School of Public Health and member of the Governor's COVID-19 Medical Advisory Team. You'll hear from Dr. Salvador Biazzo, Senior Staff Physician at UNLV Student Health Center and Faculty and Staff Treatment Center. Dr. Christina Madison, Associate Professor of Pharmacy Practice at the Roseman University of Health Sciences. Dr. Lauren Chappell-Love, Psychologist at L Psychological Services, LLC. And Dr. Eugene Olea, Clinical Psychologist. Following the presentations, there will be a Q&A session. So again, please feel free to type your questions in the chat box. And if you're joining on Facebook Live, please type your questions there. It is now time to get started with our first speaker, Dr. Brian Labus. He is an expert on communicable disease surveillance, disease epidemiology, and outbreak investigation. Labus, a registered environmental health specialist through the National Environmental Health Association, is an assistant professor of epidemiology and biostatistics within UNLV School of Public Health. Prior to joining UNLV, he spent 15 years as a senior investigator for the Southern Nevada Health District, conducting outbreak investigations and disease surveillance and implementing public health informatics systems. In March of 2020, Nevada Governor Steve Sisolak selected Labus to serve on a 5-member statewide task force to help advise on the scientific aspects of the COVID-19 pandemic. Please welcome Dr. Brian Labus.
Thank you very much, Will. It's great to be here with everyone. I'm glad I can talk to different groups. I really enjoy doing this and really enjoy sharing information about what we know about the virus, what we know about the vaccine, and how we can protect each other. It's interesting this time where we're thinking back for the past year that we've been dealing with this, looking back at how things have been so different over the past 12 months. But for the first time since we started this pandemic, we have some reasons to really be optimistic right now. If you look at our case numbers, those are all trending in the right direction. They have been since the beginning of the year. We had a large spike in disease that started in September. Throughout the entire fall, we saw steadily increasing numbers of cases and hospitalizations and deaths. But around the first of the year, after we got through the holidays, those numbers started to change direction. And for the past 7 weeks or so, we've seen a steady decline in our cases in Nevada. So it's a great thing to see that trend. This is a direct reflection of our behavior, because our behavior is what determines how disease spreads in a population. And as we are doing all the things we need to do right now to stop transmission, we are seeing that reflected in our cases. The percent positivity rate for laboratory testing is way down. It was at over 23% for our state at one point. We're down in the 8% range now. The goal is to have that number under 5%, which the World Health Organization has said that shows that we basically have things kind of under control. Now, it's not just enough, though, to reach that 5%. We have to stay there. And that's unfortunately the downside of dealing with these numbers. Like I said, it's a direct reflection of our behavior. If we get to those levels where we've started to get things under control and we back off on all the social distancing and mask wearing and all the things that we've been doing to get those numbers under control, they could easily change direction and we could see another increase in cases. Nobody can predict what's going to happen, but we know what happens if people stop trying to control the disease. It will start to rage out of control. It's kind of like when you're putting out a fire. You don't want to dump more fuel on it just at the very end when you almost have it out, because everything will just flare right back up again. And that's kind of the point we're almost getting to. And so even though we can be very optimistic and happy where we're at, we still can't back off all of those actions because we need to make sure that that transmission doesn't increase. The reason we're here today is to talk about the other thing that gives us a lot of optimism going into 2021, which is the availability of multiple vaccines that can prevent COVID. The 2 vaccines that are out there right now that are called mRNA vaccines, they are a new type of vaccine. It's one that they're types of vaccines that we haven't used before, and they've been in development for a long time. They're using things that we understand, pieces that we understand. So the parts of all this vaccine are not new, but we are using it in a new way. The exciting thing about this is that this is really a new platform for developing vaccines. We are able to quickly respond to new microbial threats and develop vaccines based on the genetic information that we can get rather quickly when we've identified some new sort of virus. So right now we have the Moderna and Pfizer vaccine, and everybody's heard a lot about those 2 in the news. But Johnson & Johnson has submitted an approval to the FDA so that hopefully we will have a 3rd vaccine joining those first 2. And this is going to continue to happen. There are over 160 different vaccines that are in some stage of development all over the world. And as those things get through the trials, there will be more and more types of vaccines available. Now, each of those vaccines have pros and cons. The Moderna and Pfizer vaccine has over a 95% efficacy, but it requires 2 doses. The Johnson & Johnson efficacy is lower, but it only requires a single dose to get them. So there are advantages and disadvantages. And as we start to have these vaccines available, we'll have to figure out how best to use these in our community. It may be that you don't have that many choices in the vaccines that you get right now, but in a few weeks, as more of these things become available, you'll have more options when it comes to protecting yourself and the people you care about. We've rolled out the vaccines in our community in 2 broad lanes. And the first lane is looking at kind of the support infrastructure for the community. We started with the medical professionals, people that were taking care of COVID patients, because we want them to stay healthy so that we can keep our deaths way down and we can keep people from developing serious disease by having the medical facilities and people we need to treat them. Once we got through that, we started vaccinating people in nursing homes. And we vaccinated them because they were at very high risk of death or hospitalization if they were to become infected. So we got really the best bang for our buck by vaccinating that targeted population. And then we really headed into those two lanes. And so we've been trying to look at the community infrastructure pieces. When we talk about reopening schools, we have to have teachers that are protected. So we've thought about things like that, or our infrastructure. If you want the power and water to run so we can run a community, we have to make sure that the people that have the skills to do those things can actually go to work and they're not out sick. At the same time, we have a second lane of people, and this has been the general population. This has all been based on the looking at the age ranges of different people, because with increasing age, we typically see increasing disease rates, hospitalization rates, and deaths. So we start with the oldest group, and then we've worked our way down. Just recently, we've started vaccinating people 65 and older. The next group that's on the list will be people with underlying health conditions from 16 or 18, depending on which vaccine you get, all the way up to 65. And then after that, we will talk about people without those underlying health conditions, just the general population. Now, the one real challenge we have right now is that there's just not enough vaccine to go around. There are orders through the federal government for hundreds of millions of doses, enough vaccine to cover our population, but it takes time for that to be manufactured and it takes time for it to be distributed. And as we're waiting for that, we see changes in the virus itself. So we've seen different strains start to circulate. These new strains pop up and it seems really scary, but this is the way that viruses multiply in a population. The strain that's circulated in the United States from day one is actually a mutation of the strain that was causing the original outbreak in China. So we've dealt with strains that have mutations since the very beginning of this pandemic. The ones that we've looked at more recently, the one from the UK spreads more easily, and as other ones pop up, we start to wonder, what do these new changes in these different strains of the virus mean? Not just for disease, but what does it mean for the vaccine? From everything that we've seen so far, the existing vaccines will protect you against those other strains. The protection may not be optimal. It may be a little less protective against certain strains, but from everything we've seen, it's still sufficient to protect you against those viruses. And as new strains show up, we'll have to understand what's happening with them and what that really means to disease transmission in our community. But one of the exciting things about the mRNA vaccines is they can quickly change the formulation of the vaccine to deal with any of those mutations. They've already started working on that for the Moderna and Pfizer vaccines. They're putting vaccines into trials right now to make sure they still work against those particular viruses that are tailored to those other strains. And so we have the ability to come up with a vaccine that matches what's going around as these new strains pop up. And it doesn't take us very long to do that because we have the process established. All we're really changing is kind of the information, that genetic information, that genetic code in the virus or in the vaccine that ultimately provides the protection. So even though we see these new strains circulating, there's still a lot of optimism around the vaccines. I'm convinced by this evidence that they're effective vaccines and that they are safe vaccines. So much so that I was absolutely willing to get the vaccine. I run a public health contact tracing team, so I had the opportunity to get vaccinated as part of being a public health worker. I went in the first time slot on the first day that it was offered to me. I got my second dose on Groundhog's Day. The first day I had a little bit of a sore arm after dose one, and that was it. The second one, my arm was a little more sore. The next day I felt a little crappy in the afternoon for a couple of hours, and that was it. So I'm one of the fortunate people who's had very mild effects from this vaccine. You'll hear about a range of different effects that have happened. On my team, I had people that wound up sick for a day or so, had a fever, really just couldn't get out of bed, felt miserable, but a day later they were feeling better. And so everything we've looked at with these vaccines shows us that they are effective in preventing disease and they are safe for us to use at the population level. And I would strongly encourage everyone to get vaccinated because it's the best thing you can do to protect yourself from the serious effects of COVID. So with that, I will turn things back over to Will.
All right. Well, thank you so much for that information, Dr. Labus, for sharing your story of being vaccinated and helping to dispel some of the fears that I personally held around these mutated strains and knowing that the vaccine will be able to modify in order to combat those. So thank you for your presentation. Next, we will have Dr. Salvador Biazzo. Dr. Biazzo earned his medical degree from the University of Medicine and Dentistry of New Jersey, where he also served as chief resident. Prior to his medical career, Dr. Biazzo was a research associate in the immunology laboratory at Rockefeller University in New York. He has been practicing family medicine and HIV medicine in Las Vegas since 2001, providing care to the LGBTQ+ community. He joined UNLV in 2007 and is currently the senior staff physician of the Student Health Center and Faculty Staff Treatment Center. He has addressed healthcare disparities within the UNLV community by starting the transgender care team and providing ongoing cultural competency training for the Student Wellness Center staff. He has promoted best practice guidelines for LGBTQ+ healthcare, not only at UNLV, but on the state level through his participation in the Nevada Coalition for Sexual and Gender Minority Healthcare and Nevada Gender Affirming Healthcare Project. Dr. Biazzo has also served on both the UNLV Biomedical and Sociobehavioral IRB boards, reviewing research studies to help ensure the safety of human research subjects. Please welcome Dr. Biazzo.
Good morning, everyone. Thank you, Will, very much for that introduction. I would like to offer my perspective of having dealt with the pandemic in the trenches and give you my personal experiences and what I've seen. And as you all know, it was a very scary time about a year ago when we first realized this was a pandemic and it was spreading rapidly, and many people, especially in Italy at the time and in China, were dying. We didn't really know much about this disease other than it was caused by a coronavirus. And so at that point, I think that's where things started to get a little bit worrisome and induce some panic because we didn't really have any answers at that time. We were getting mixed messages from state, federal agencies, from the World Health Organization. And I think that's where some of the fears started, is because, people could sense that, we didn't really know what this was all about and how bad it could be. And so I think people started getting afraid. There were also some mixed messages in the beginning where, some folks were promoting not wearing masks versus wearing masks. And so not everyone was transparent right from the beginning, unfortunately. And so I think this has kind of led us to where we are now, where there's a lot of hesitancy around this virus and around the treatment for this virus. And so we're here to kind of help dispel a lot of that today and maybe encourage folks to feel a little bit more comfortable. One of the main things I see, having worked in the office treating patients with COVID, and also working at the point of distribution center, the vaccine clinic that we have here at UNLV, giving the shots, both Mrna and Pfizer at the distribution center here. I find that most of the time I'm dealing with either folks that are having a lot of anxiety before getting this vaccination, but they know they're doing the right thing by coming. And then in the post-vaccination area, that's where I'm seeing quite a bit of panic attacks, people passing out, things of that nature. And a lot of that is based off of fear about, oh my gosh, did I just do something to myself that I can't take back that, is going to harm me in some way? And so what I'd like to do is maybe just offer some information to everybody to kind of help unravel some of this and make everybody feel a little bit more comfortable about getting this vaccine. I'll start off by saying I've received both doses of the Pfizer vaccination, and on the first dose, I felt nothing at all, which, kind of surprised me because I was expecting to feel something. And so, the next day, maybe I might have felt a little bit of fatigue. So I thought, wow, this is not bad at all. And so on my second dose, a few hours later, I started to feel some arm pain, had some body aches overnight, no fever, just a little fatigue, but not to the point where it stopped me from doing anything. And I didn't even have to take any Tylenol or ibuprofen or anything. So from my personal standpoint, I tolerated the vaccination very well. One of the major problems that most people, when they get the vaccination, have are very similar things: some arm pain, mild headaches sometimes, some body aches, maybe some slight fever, but most of these go away within 24 to 48 or 72 hours at the most for some people, for most people. So let's talk a little bit about this vaccination, and I think a lot of people are really freaked out about it because they're worried that, wow, how did we get this vaccination so fast, and is it safe? Has it really been studied? And I understand people's fear about that. But if you really look at how the development process has gone through, it has gone through the same way that any other vaccine gets approved. And there have been clinical trials on thousands and thousands of people that were done to first make sure that it's safe to distribute. In regard to the manufacturing process, yes, this was developed pretty fast, and thankfully it was because of mRNA technology, which is why we went this direction with this vaccine, because typical traditional ways of making vaccines involve manufacturing a certain protein that the virus has that's unique to it, so that we can form an antibody response to it. This takes time to create in the lab and then mass produce to get out there, and there are a lot of guidelines in regards to making sure that every lab is consistent with how they're producing the protein and all this stuff. So basically what mRNA did is it bypassed all that. Instead of producing this protein in a lab and then putting it into our bodies, we're making our bodies produce this protein, so our immune system then reacts to it. So we're our own manufacturing factory per se. So what they did was, and let me back up for a second and tell you that mRNA technology has been around for more than 20 years. It's been used in cancer treatment to help our antibodies fight some cancer cells. But of course, this is the first time it's being used for immunization. So people haven't really heard about this technology before, but it's not as new as some people would think. And so what we basically do is we kind of go ahead and do what the virus does to us, right? So you've got this virus, it's got this outer shell, and inside is material like a blueprint. In this case, it's RNA that gets injected into our bodies and goes into our cells and then gets reproduced. And basically the virus is causing our bodies to manufacture more virus, and then we get sick in the process. What mRNA technology does is it just takes a piece of that spike protein, the messenger RNA that codes for that. And what it does is the technology puts it into basically a little fat lobule, okay? And what it does is, and that's needed in order to get into the cell. So once that gets into your cell, now that mRNA is in the cytoplasm of the cell, not in the nucleus. It never gets into the nucleus and never gets incorporated into our own DNA. And so what happens there is it gets manufactured and lots and lots of the spike protein get produced. It's then on the surface of the cell, and our white blood cells realize this doesn't belong there, and antibodies are formed along with memory cells that then will remember that doesn't belong here either. And so that's how the vaccine actually works. After, I think it's just within a few weeks, any of that mRNA gets destroyed by our own cells. So this does not leave any kind of permanent effect on us. It doesn't stay in our bodies. It doesn't get incorporated into our genome or into our DNA at all. And so that's how we were able to get this vaccine out so fast. But all the steps that were needed to get to that were the same as any other vaccination that's been out there. If you look at the incidence of adverse effects, it's no more than any other vaccine out there. And with that, it's a very, very safe vaccine. While I'm walking around in the post-vaccination area, again, most of the things I kind of have to deal with are panic attacks. People complaining about, oh my gosh, my heart's racing. Now we have to take that seriously. So we have to assess every single person who has a problem after vaccination and make sure that we actually make sure that it's not something else going on that's related to the vaccine. And so most of our vaccination sites have medical personnel that are there to attend to you in case you need something. There are people there that can answer your questions. And so I would just want to kind of let you know that this is something that's been planned out well. The manufacturing process of this has been tried and true. No real steps have been skipped that would affect its safety at all. So I encourage most people, especially folks from marginalized communities, because we're mostly at risk for getting a bad case or dying from COVID, because especially a lot of people in the LGBT plus community have comorbid conditions, diabetes or HIV, or have lack of access to healthcare and might be dealing with diabetes that's uncontrolled or hypertension. And these things set you up for a very bad infection and possibly death from this virus. And so the risks of this vaccine are minimal compared to what could happen to you if you get this disease. So thank you very much for your attention. I hope I've been kind of able to unravel some of this for you today and instill a little bit more confidence with getting the vaccination.
Well, I must say you absolutely have for me. So thank you for that. Thank you for your candid presentation and sharing the history of this particular technology. That is an extensive history, 20 years. So thank you for your presentation. Next up is Dr. Christina Madison. Dr. Madison is currently an associate professor of pharmacy practice with Roseman University of Health Sciences, College of Pharmacy, and the founder and CEO of the Public Health Pharmacists PLLC, a public health consulting firm. She is a clinical pharmacist specializing in public health with a focus on infectious communicable diseases. She maintains 2 active clinical practices with Huntridge Family Clinic, which focuses on the LGBTQ community and is one of the largest providers of HIV prevention and gender-affirming care services in the state of Nevada, as well as Volunteers in Medicine of Southern Nevada, where she offers immunization and communicable disease care. Advocating for public health and the profession of pharmacy to improve the health and wellness of vulnerable populations and the underserved is her passion and mission. Please welcome Dr. Christina Madison.
Thank you so much, Will, for that amazing introduction. So a few things that I want to point out. It's hard to follow those 2 amazing speakers, but a couple of things that I wanted to point out as, a woman of color, as well as a vaccine advocate, a public health advocate. I do want to address sort of the elephant in the room, which is that we are having challenges right now distributing this vaccine equitably. And so it is something that the governor is looking at and has assigned a task force to address some of those discrepancies. And as somebody who is part of that community, especially our communities of color and our Indigenous brothers and sisters that have been disproportionately impacted by this virus, it's really important for us to try our best to try to get this vaccine out to those who need it. And so again, the more that we get information out like this panel discussion, and the more people's fears are alleviated and we increase vaccine confidence, the better off we will be in ending this pandemic. So I just wanted to start off with that and know that is something we are actively addressing and hoping to do better as we continue to roll out this vaccination effort, because it is something that is a monumental task. And as somebody who's worked in public health for now almost 16 years, this is my Super Bowl. This is what I get up in the morning for. This is, what fills my cup up. And I'm sure Dr. Labus would say that as well. As I worked with him for many years at the public health department, I was embedded at the Southern Nevada Health District for about a decade as their clinical pharmacist. So I'm sure that all of that time and effort working with the health department has both influenced and impacted our desire to really be out front in educating the public about the things that we can do to help protect our families and our friends against COVID-19. So again, we have a vaccination. We have 2 vaccines that are currently available for emergency use authorization, with a third on the way and potentially a fourth and fifth in the coming months. So this is all very promising news. And actually, as we were on the webinar, the Biden administration just marked the 50 millionth vaccine, COVID vaccine dose administered in the United States, which is a huge milestone as we try to reach that goal of 100 million doses in the first 100 days of the Biden administration. So the vaccine rollout, we are continuing to improve it. As somebody who has been on the front lines, vaccinating patients, coordinating vaccine efforts, working with the state, I want you guys to understand kind of what to expect when you go to get vaccinated. So obviously the appointment process has been a little bit challenging for those, especially if you don't have internet or access to online resources. That could be a potential barrier. And so we're trying to overcome that by having things like a hotline. So if you guys have information about or need information about the vaccine or where you can go or whether or not you're eligible, our state immunization registry, which is called Immunized Nevada, has put together some amazing resources. So you can actually visit, it's nvcovidfighter.org, or you can call the hotline, which is 1-800-401-0946. And they can help you to determine if you're eligible for the vaccine, as well as help you to make an appointment. So these are two resources that are something that I think is going to help us with the vaccine rollout and being able to get access to those, especially in our vulnerable populations like our gender and sexual minorities that may have more challenges with access to care. So one of the things that the state has been able to do and has been able to partner with Roseman University on is to do these community, what we call community strike teams. So we go out into these individual communities, in particular senior centers, and we vaccinate people in their community. And that really helps because not only is it a safe space for them, it also is bringing the vaccine to the people who need it most. And that's really what community health is about. And that's what public health is about. You have to meet people where they are in order to help them to have confidence in the vaccine, as well as seeing people who look and sound like them, talking about their story and whether or not they recommend vaccination. We know when a healthcare professional recommends a vaccination to a patient, they are much more likely to receive that vaccine and to complete the vaccine series. I also wanted to address my own personal journey with the vaccine. So as our other two speakers has mentioned, they are both fully immunized. And so what we mean by fully immunized is that you've received both doses of the vaccine and you've given your body enough time to mount an appropriate immune response and develop those antibodies. So these messenger RNA vaccines, I liken to kind of the Snapchat of vaccines, right? It goes to your cell, it shows your immune system a picture of that spike protein that is on COVID-19, and then that messenger RNA really just disappears within minutes to hours. So with that being said, things to expect because we are enlisting our immune system to help. We know that those individuals who've already had COVID-19 are more likely to experience side effects from the vaccination, as well as individuals who are younger. So if you look at the study data from both the Pfizer and the Mrna product, we saw that those who were younger than age 55 were more likely to experience side effects. And so with that being said, I'm very honest and upfront with patients when I vaccinate them and I tell them what to expect. Because again, honesty and transparency is really going to be key in order to develop vaccine confidence as more and more people become eligible for the vaccination. Because right now we are at limited supply and we only have enough for certain priority groups. But once we get to the point where we do have enough vaccine to be able to offer it to all those who want to be vaccinated, those individuals really do need to be notified about the potential for side effects. So number one, if you're younger, you're more likely to potentially have side effects. Number two, if you've already had COVID-19 and it's been less than 90 days, then you are potentially more likely to experience side effects. And number three, the second dose of the vaccine usually is more pronounced as far as your ability to have possible side effects from the vaccine. So for me personally, I experienced a sore arm, felt a little tired, and had a little bit of a headache on the first dose. But the second dose, I got the full-on fever, chills, body aches, flu-like symptoms, and was very tired. And I was basically out for the count for a whole day. But as soon as I got those side effects, they left just as quickly as they came on. So I would say I probably experienced those side effects for about a full 24 hours. But then after that, I felt completely fine, as if nothing had ever happened. So couple more things I just wanted to point out. So being fully immunized, again, is 14 days after you've received that second dose. So if you are somebody who received the Pfizer product, that would be after the 21 days from getting the second dose. And then if you receive the Moderna product, that would be 28 days after receiving the second dose. And it's really important that you try to get vaccinated on or very close to that date, because we don't want to leave you unprotected, because again, you only get partial immunity from that first vaccination. And then the other thing too that I just wanted to mention is really just thinking about who do you want to protect in your community? And our elderly population, we know, is also at risk. And so in our gender and sexual minority populations, our LGBTQ brothers and sisters, if we know people that are in that community that are older or maybe don't have access to a computer, we want you to adopt that person and to shepherd them through the process. I can't tell you how many people I helped at one of our community centers that if their grandchild or their neighbor or their friend didn't help them with the process, they probably would not be vaccinated. So if you know somebody who's in need, who's part of that priority group, please help them to get through the process. And then when it's your turn to get vaccinated, don't hesitate. Please don't waste your shot. Don't throw away your shot, right? Like Hamilton, not throwing away my shot, right? So make sure that you get it when you're eligible, because that's what we need in order to get the end of this pandemic faster. And with that, I will turn it back over to our amazing moderator.
Thank you so much for all of that information. And before you go, could you share that phone number one more time with us?
Absolutely. So the two places that I mentioned, so the first one was the nvcovidfighter.org, and then the phone number is 1-800-401-0946.
Thank you so much. And we'll put both in the chat for our audience. Dr. Madison, your passion, your compassion and care absolutely shine through. Thank you for all that you are doing and for sharing your time with us today. We'll have some questions for you, I'm sure, at the end. Next up is Dr. Lauren Chappell-Love. Lauren Chappell-Love is a licensed counseling psychologist. She completed a bachelor's degree focused in forensic psychology in 2007 at Bay Path University, her master's in forensic psychology in 2010 at the Chicago School of Professional Psychology, and then went on to secure her PhD in counseling psychology in 2018 from the University of North Dakota. She earned additional experience in a predoctoral internship with the Department of Justice, Federal Bureau of Prisons in 2018, and completed postdoctoral training in 2020 at a forensic private practice. Dr. Chappell-Love's clinical experience primarily lies in forensic and correctional psychology. While in the community, she has worked with court-mandated individuals and in sexual health. She is focused on diverse populations and the ways that they process and can excel while living within systems of oppression and majority culture spaces. The screen is yours.
Awesome. Thank you so much, Will, for, as always, the, the best introduction imaginable. It makes me look really important. As we start to kind of talk about the vaccine and the entire process, I am here with these amazing colleagues of mine. I'm feeling some imposter syndrome kind of bubble up a little bit, actually, because they're able to really put a lot of the fancy words and a lot of their own experience on what the vaccination process and the testing process looked like. I was just going to offer a bit of my personal experience. So this is just Lauren here, not even Dr. Chappell-Love. I went in March 2020 to Washington, D.C. For a business trip for the American Psychological Association, their practice leadership conference, and was exposed to COVID-19. This was back in March 2020. We didn't really know what was going on with it. They handed out hand sanitizers and told us, I don't know, let's maybe, you know, kind of shake with your elbow, which was kind of weird. It's still pretty weird. I never know, like, to do the Wakanda salute or if I should be curtsying. It's still not a thing that I've come up with a good answer for. So came back to Las Vegas, certainly, after being exposed, and ended up wanting to get tested because I was asymptomatic. I don't believe I had any concern at the time. Could not get tested for months. And so finally got tested, and that process, you know, that Dr. Madison speaks about, like that harm reduction process, was the entire reason. I'm relatively young, although my knees might not think so, and have no real huge concerns. It's likely that I would survive, I think, I don't know. But from that, I wanted to ensure that I'm doing my part on that harm reductions kind of scale. So I see people in the office, and I engage with other staff. You know, I do private practice work and things like that. So as a person that's seen patients, I wanted to make sure that I was getting tested to ensure that even though I was asymptomatic and felt fine, that I wasn't passing something along to someone else. That to me has been this whole process. I am likely to survive by all that I know. However, it's more important that I work within the community. It's not about me. That's why I wear the mask. That's why I do the testing. That's why I engage in social distancing and things along those lines. Was finally able to get vaccinated. I'm a part of Tier 1 is what Nevada called that. And that just means that, like, doctors and physicians and other people who see patients and have access to folks that might be a higher risk group, or that one of those protected groups that we would like to ensure that they have the least amount of consequences possible. So the first opportunity, I used my privilege and my computer know-how, which is very limited if you know me, and internet connection, and I got the first available appointment that I could. I thought that was especially important, being a Black woman, a Black queer woman, being able to show and have a visualized process that I'm also trying to learn as much as I can about the vaccine, but that it's really important for folks like us to get it, because I would not have the same chances by happenstance of these marginalized groups I just disclosed in surviving if I were to go to the hospital. And so got vaccinated as soon as possible. Maybe 10 days after the first vaccination, I was feeling fine. I had a sore arm, but it was really similar to a sore arm if you're working out, or a sore arm like for a flu shot. So it wasn't anything that really tripped my radar. Maybe 10 days or so after the first vaccine, I got what I learned online was called COVID arm. The fancier pants name for that is like a delayed cutaneous hypersensitivity, which is to say that I had an allergic reaction. So it was just a spot on my arm, maybe 2 inches in diameter, that felt hard to and hot to the touch. And really, that went away. I took some Benadryl over the counter and was able to thankfully have that be the only kind of negative consequence I had. I got the second shot. I did Mrna, and that was earlier in February, and almost a day or a couple days after went right back to that kind of COVID arm, that hard lesion on my arm, which also included like fatigue. I slept maybe 12 or so hours that first day. So for me, I tell people, especially after the second one, maybe plan to wipe your schedule for a day just in case. And certainly within about a week, I was feeling just fine. I'm maybe 3 or 4 weeks out now. I'm feeling absolutely a-okay. Another thing that was important, I made a appointment to sign up, and there were not a lot of slots. And so I tried to make an appointment 5 days before the 28-day deadline, and I got turned away at the door. They said, nope, sorry, can't help you. It has to be within 4 days. So that's another thing I tell folks, to ensure that it's within a 4-day on either side. As Drs. Biazzo and Madison were talking about, and being able to ensure that you're well within that limit, or they might tell you that they can't help you. So that was my personal experience. I share that because I'm hoping to take some of the mystery away, and I did have some negative consequences, but to me, it was nothing that ibuprofen and taking a nap could not handle. Benadryl, as I said, and my hope is that that's going to be far better than the alternative. So hopefully I'm helping to keep, I'm doing my part. Back to you, Will.
Awesome. Thank you so much for sharing that story. Your humorous side is quite interesting. So I appreciate you sharing that with us today. Also, thank you for the tip about it being within 4 days of that window, because we don't want people going and being turned away. So again, thank you for sharing with us. Next up is Dr. Eugene Olea. Dr. Olea currently serves as a licensed clinical psychologist on the VA Southern Nevada Healthcare System's Behavioral Health Interdisciplinary Program. He completed his postdoctoral residency and his predoctoral internship at the Miami VAMC in rehabilitation and recovery. He completed his doctoral training at Xavier University and earned his undergraduate degree from the University of Pittsburgh. His research and clinical interests include the unique presentation of severe mental illness, substance use, and trauma in minority populations. Please, Dr. Olea, the floor is yours.
Time to start my video. Give me a second. All right, can you all hear and see me okay?
You look great.
Great, thank you for that introduction, Will. Really appreciate it. So similarly to Dr. Chapelov, I was asked to speak about my personal experiences with the COVID-19 vaccine. I received the Pfizer vaccine about 3 months ago through my job, and it was a fairly straightforward process that didn't differ from any other time I've received the vaccine. Now, I will say that the vaccine did burn somewhat when I was initially injected, but other than that, I was fine, other than some soreness in my arm over the next few days. It was relatively the same process when I got the second shot 2 weeks later. Now, also when I received the second shot, I did get somewhat sick. I experienced some of the expected side effects like fever, muscle aches, and some fatigue. I was a lot like a 24-hour cold, but after that first day or so, I was fine. Now, in addition to my personal perspective, anxiety surrounding the vaccination is something that I also manage in my clinical work. When working with my patients, they're understandably concerned about the information and misinformation surrounding the vaccine and how to parse that information out, which sources to trust, and ultimately whether or not they should get vaccinated. And regardless of the therapeutic interventions that we use in our work together, consistently, in my experience, the factor that has been most predictive of my patients getting vaccinated has been a trusted loved one getting vaccinated and speaking openly and honestly about that experience. So I hope that one takeaway that you all have from this presentation is the powerful impact that you all can have on your loved ones and their likelihood to get vaccinated as well. And with that, I will pass it back to Will. Thank you, everyone.
Thank you for sharing that with us. I think that you absolutely are spot on. We, by doing this and sharing our stories, are making a difference and helping others to feel more comfortable doing what's in the best interest of. So with that, I just want to say thank you again to each panelist for sharing your perspectives and the insight. Now I'd like to move forward with our Q&A period. So if you haven't already, please feel free to ask your questions. You can send them anonymously to the host or post them directly in the chat. If you are with us on Facebook, please feel free to post them in the chat there as well. And I want to start with you, Dr. Olea, and this is just a real quick question. What are some tips that you could provide to our viewers and to each of us to manage the anxiety around getting the vaccine, or once you've gotten it, any anxiety that may linger?
That's a very good question. Well, thank you for asking that. So just my personal modality that I operate from in my clinical work, it's called dialectical behavior therapy. I won't get into the nitty gritty of that modality, but one thing that it emphasizes is checking the facts of the situation, and more specifically assessing if our reactions to something are coming from are coming from the facts of the situation, or our thoughts relate our interpretations of that situation. And so as it relates to the vaccine, after patients have been vaccinated or when they're thinking about getting vaccinated, somewhat on a case-by-case basis, I'm applying that same model of these thoughts that you're having, these fears, these anxieties, these concerns that you're experiencing. are they coming from what you're like some physical, or are they based in reality, or are they coming from your thoughts about some misinformation, as I spoke to earlier, that you've received, and like having discussions about that in various ways to manage that.
Awesome. Thank you for that. And Dr. Popolov, I invite you to answer the same question. What are some tools or tips you would have to help us to manage any anxiety around the vaccine?
I actually love what Dr. Olea was going into. I can personally confirm that I have definitely heard him say, are we coming from a place right now of thoughts or facts? Another alternative way to look at that, maybe from a different modality called like a cognitive behavioral therapy. And again, not to get too much into that, but really trying to tease out and separate and take a look. Am I experiencing something that's based off of feeling, or something that is more based in my thoughts, and taking a look at how those two things impact one another. And so if I'm having a thought like, well, I read one article, or I saw one article on a news source that said that someone had a negative reaction, or my gosh, somebody died as a result of a vaccine. And so I really want to start to identify what thoughts I have there, and maybe start seeking out other rational or factual pieces of information that lets us know, what was going on with that person, or what's the likelihood, or why is it that we're trying to get vaccinated. So I would say that Dr. Olea kind of hit the nail on the head, but there's another perspective as well.
Perfect, thank you, and absolutely agreed there. And panelists, thank you for turning on your cameras for us so we can all see your smiling faces. I invite any of the audience that wants to ask their question live, perhaps, just raise your hand and we'll make sure to get you to ask live so we could see you as well. While we're waiting for another question to come in, we did have some over the course of the presentations today. So this one is for Dr. Madison. And it's really around your work with immunizing and working at the Volunteers in Medicine. How has that experience shaped your perspective of the vaccine?
Yeah, so thank you so much for the question. So with Volunteers in Medicine, my role there is, I have many hats, but one of the things that I did with them about 3 years ago is I was helping them to kind of incorporate more vaccination services into their day-to-day primary care practice. And then when we got notice that the COVID vaccine was available, we actually went through the process of requesting vaccine from the state, making sure that they had everything that they needed on hand. And interestingly enough that you asked, this Tuesday was actually our first COVID vaccine clinic at Volunteers in Medicine, and we vaccinated 30 patients and volunteers. So it was a really huge milestone, I think, especially coming from a free clinic, just because of all the resources and all the things that you need in order to do the vaccination. So just to let you guys know, even though the federal government is picking up a good portion of the cost, as well as shipping directly to participating clinicians and clinics, there is still some amount of what we call ancillary supplies that's needed beyond what the federal government sends you. So they'll send you needles and maybe a few alcohol pads, a face shield, and some masks, but they don't send you any gloves. They don't send you any sharps containers. Some of the other things that we need to really get a clinic off the ground, those things aren't sent to you. And so, it is sometimes a bit of an expense, especially if a clinic isn't used to doing vaccinations. And so, I'm really excited that Volunteers in Medicine has taken on this job, because a large portion of their patient population is potentially undocumented, as well as being uninsured. And so we know that that's a vulnerable population that now has an amazing access point to care.
Awesome. So you can take credit for 30 of those 50 million that we reached today then.
Well, I could actually take a little bit of credit for a few more of those. So Roseman University, as of last weekend, has vaccinated over 3,000 patients in the Las Vegas area against COVID-19.
Wow, that's amazing. Thank you for that. Really appreciate it. One more question for you. And this is, does this vaccine impact any type of medication that one may take for HIV or any other condition?
Yeah, so that's an excellent question, and one thing that I've tried to address with my patients at Huntridge, as well as I've done a couple of discussions with our support group that we have with Community Counseling Center. And so one of the things that we've figured out is that just having a positive status is not an independent risk factor for having severe complications associated with COVID-19. So I am encouraging all of my my individuals that do have a positive status to make sure that they do get vaccinated, because it's not just their HIV status, but it's typically the other chronic medical conditions that they have, like diabetes, heart disease, lung conditions, the fact that they may be more likely to have issues with substance use and abuse, which also we know disproportionately impacts our LGBTQ brothers and sisters as well. And so as far as the medications, there's no specific medications that interact with the vaccine. If anything, being on medicine for a positive status should be an indication for you wanting to get vaccinated, because we want to make sure that you're protected, because you may have some of those other chronic medical conditions that may make your course of COVID-19 more severe, resulting in a hospitalization, maybe even ventilation, and possibly death. And so again, when we look at those medications, I think the one that's come up the most frequently and is actually asked in our questionnaire is the use of blood thinners. And so those use of blood thinners is one of the things that we specifically ask for. And part of that is because we obviously don't want the patient to have, you know, issues with bleeding, but that's one of the main ones that we ask about. But as far as it being contraindicated, it's not a contraindication, as well as some of the data out about pregnancy and lactation, which again, it's not that it's contraindicated, it just wasn't specifically studied in the population that we looked at for either the Pfizer or the Mrna product. But they are now continuing on with their phase 3 data and now enrolling some of those additional populations, such as pregnant women, those who are breastfeeding, as well as now they're testing it in younger children as well, down to the age of 12.
Thank you. Dr. Biazzo, do you have anything you'd like to add to that?
Yes, actually, I've had quite a few questions from patients that have come in and they're on multiple different medications for either rheumatoid arthritis or methotrexate, patients on HIV medicines, as Dr. Madison had suggested. Most of these medications will not interact with the vaccine. The only thing I will say is that if you're on an immunosuppressant drug for either an organ rejection, you know, to prevent organ rejection, or to treat certain rheumatic diseases, it might cause you to have a little bit less of an antibody response because your immune system is suppressed a little bit, but that's certainly not an indication to not get the vaccination. If anything, you really certainly should get the vaccination to at least give you some more protection against the disease.
Sorry, I love talking to people with my mic off. Thank you for your insight. I wanted to ask, earlier you gave us such a great understanding of the way the vaccine actually works. I have heard rumors and myths that it does change your DNA. Could you share a little bit about that?
Sure, Will, thanks. I'm glad you asked that. It does not change your DNA whatsoever. It does not ever enter the nucleus of your cell. It stays in the cytoplasm, okay? If you envision a cell to look like kind of like a fried egg, okay? You've got the major part of the cell, all this stuff, the white part of the egg is the cytoplasm, and then you've got the nucleus, which is the yolk, okay? And so what happens is this vaccine, the mRNA is injected into your muscle, so it gets into a muscle cell. And so what happens then is the mRNA enters your muscle cell into the cytoplasm, that you know, the white part of the egg, okay? And so what happens is the mRNA then starts attaching to what's called a ribosome, which is kind of like the factory that is going to produce all this extra spike protein on your cell, right? And so what happens then is that this protein is expressed on the cell and your immune system kicks in and starts to make antibodies. It never gets into the nucleus of the cell, never gets incorporated into your DNA ever.
Thank you. That's insightful. I think we need a billboard with just that clip on it so everyone hears. All right, Dr. Labus, this one is for you. Why do we have to wear a mask once we're vaccinated?
The purpose of the vaccine is to prevent as much disease as possible, but it doesn't prevent all disease. When we looked at the clinical trials, they found that the rate of disease in people who were vaccinated was 1/20th the rate of the people who weren't vaccinated. But there was still some disease that occurred to them, occurred in that particular population. So what we're talking about here is reducing the risk as much as possible, but we're not talking about completely eliminating the risk of COVID after we have been vaccinated. So in addition to that, there's the risk to you, but there's also potential that you still could spread it. We're still trying to understand how the vaccine works in terms of you getting infected with maybe an asymptomatic infection and spreading it to somebody else, not having any symptoms yourself, but being able to spread it to another person. And that's one of the big reasons we wear a mask, so that you can't spread that virus to somebody else. When it comes to vaccines, most of them are not perfect. It's kind of like a car with a bunch of modern features. We have crumple zones and airbags and seatbelts and all these things to save your life. And it does a good job at that. Deaths are way down in automobiles compared to where they were in the 50s and 60s, but people still die in car accidents. And it's the same idea here. You can protect people as much as possible, but sometimes people will still get the disease. And so that's why the mask use is still important, even if you've been vaccinated.
Will the same be true once we have the Mrna booster shot?
The booster shot is really targeting one particular strain, and it's likely to be the same issue. It'll provide good protection, but not perfect protection. And that will probably be true of every vaccine. We have vaccines that get close. We have some that are 99.9% effective, but there's always the chance that with a vaccine, you'll have people that don't mount an immune response. You know, we mentioned the immunosuppressive drugs where you may have a weaker response or something like that. And so we'll still have to wear the mask until we have the disease under control in the population, and your likelihood of being exposed to it in your day-to-day life goes down to very low levels.
Thank you. The next one is really open for the panel, but I'd like to start with Dr. Olea. What is the role of individuals such as community health workers and home healthcare workers in the acceptance of this vaccine? How can trusted community providers work to increase and diminish hesitancy?
Well, I'm so sorry. You were breaking up a little bit, and I was able to catch bits and pieces of the question. Could you repeat it? Repeat yourself? I'm sorry.
No worries. Really just trying to understand your perspective on how trusted sources impact the acceptance of the vaccine and hesitancy.
Oh, okay. So it might be a connection issue with me, because I still wasn't able to quite catch it, but it sounds like, and correct me if I'm wrong, of course, but how can providers increase just the public's trust in getting this vaccine? Is that what you're asking? Yeah, okay. So one, thank you for the question. And in my experience, the biggest way that the public's trust can be increased, is being open and honest about our experiences with the vaccine, like all of my colleagues have been today, as well as being open about the transgressions of the past. I mean, again, we don't need to necessarily go into the revisit history in that way, but being as it relates to certain communities, for example, the Tuskegee experiment, later studies, things of that nature, and the effects and the impacts that they've had on those communities, and how it eroded public mistrust, and how and the history of how the medical community, scientific community has worked to regain trust in that way. I think being open about those things and really willing to engage the people that we work with on a pragmatic level about those things is the biggest, in my opinion, the biggest way that we can build public trust. Yeah.
Thank you. All right, Dr. Chapel, this one is for you. As far as the vaccine is concerned, we know kind of the rollout here in the state. What is your perspective on how the vaccine is being rolled out with those that may be incarcerated?
There's a lot to unpack there. There are, there's a lot, I think, having to do with mistrust. Certainly, BIPOC communities, Black communities, queer communities, in a lot of ways being the certainly impacted by like health disparities there. If you are an individual that is within one of those marginalized groups that also is a person who's criminally justice involved, there are additional concerns. I have a whole host of privileges, right? But one of them is that when people who know a lot more than I do about cells, Dr. Biazzo, I was thinking the mitochondria is the powerhouse of the cell while you were speaking, but when doctors and professionals tell me to stay away from other people, I have that privilege, I can do so. If I were a person who was incarcerated, I might be in a 6-person pod and I can't maybe do that, nor can I control certainly the awesome correctional officers who are out there protecting us, as people who are incarcerated. From that, there's a lot of concerns there. I was saying being able to reach out to your family members, if you do know people that are criminally justice involved, being able to explain to them, if possible, through letters, email, phone calls, visits, anything along those lines, the information that you have. We have a whole host of people on here today that are sharing that info and being able to tell folks, this is not a myth. This is not something that somebody's making up. This is why it's important even to wear a mask, and to protect yourselves as much as you can, because I would definitely say that the research is trending, and there have been incidents in St. Louis, for example, a couple weeks ago where inmates were being very vocal about the lack of protections that they've received from COVID. And so that is something I think that's happening all over our country. And though certainly NDOC is doing an awesome job, but being able to reach out and just let your loved ones know, if you're able to speak with them, that this is what's going on and this is why it's important. And to Dr. Alea's point, how historically the AIDS crisis was handled, Tuskegee, things along those lines, really addressing those and being visual. I think it's hugely important to have people like Dr. Madison, who are, Black identified and being out there and saying this is what we know, and we in fact are not taking a back seat to the healing process here. So.
Yeah, thank you so much. We have a question from Vince Collins. Vince, are you there?
Yeah, actually, I didn't have a question, but I just wanted to say thank you all for this amazing information. And I will put out that, specifically with our LGBTQ plus community, we're seeing a lot of reluctance in our trans community about safe spaces in regard to getting tested and getting the vaccine. So hopefully there'll be some consideration in creating sort of unique spaces in where vaccines are being distributed and where testing is being distributed. And I'd like to mention that at the LGBTQ plus Center of Southern Nevada, we're going to be initiating testing on March 2nd from 8 to 12. And it's open to the community, but it's primarily to address the issue of individuals feeling, they're getting tested, they're being vaccinated, and at some point in safe environments and in inclusive environments. Thank you.
Yeah, thank you for sharing. Sorry, I saw your hand raised, so I thought there was a question, but I appreciate you providing that content for us here.
It's all good. I got it in. Appreciate it.
And I just want to echo that same sentiment. So Vince and I have actually worked together for many years. And one of the things that we were able to do this past fall was that we did flu pop-up clinics at the center. And I think that really helped a lot because we were meeting the people where they were, right? So not only did I do flu clinics there, but we also did it at Avella Pharmacy, which is a specialty pharmacy, but they do take care of a lot of people with a positive status. It's right underneath the Wellness Center at UMC. And so again, going back to that community engagement and working with community partners, not just community partners that are at health centers, big health centers, right? Because some people may be fearful of doing that, but working with like faith leaders and churches and synagogues and all of these places that we know that people gather and feel more comfortable in that space. We need to do a better job of getting access points in those areas. And I think as we get more vaccine supply, and especially vaccine supply that isn't so tenuous when it comes to storage requirements, we will be able to do those kinds of pop-ups, as well as even thinking about mobile units to go into areas of the city where we maybe have things like pharmacy deserts. So we do have pharmacies that are providing vaccines, but there are places in this town where there is not a pharmacy within walking distance. And there are still people who don't have cars. So you have to think about that too. So when you think about drive-through testing, that doesn't work for people who don't have a car, right? So we have to think about all of these things when we're thinking about access and equality and equity with getting out, not just testing, but vaccination.
Dr. Madison, I think you had to be looking at my notes because transportation was my next question that was coming up. So thank you for addressing that. And I'd actually like to open that up a little more broadly for the entire panel, which is simply the question of health equity, understanding that racism, of course, is a public health issue. And when we're dealing with making a more equitable distribution of the vaccine, that can be easier said than done. Any insights or ideas that you may have to ensure equitable distribution? And Dr. Madison, since you're on screen, we'll start with you, and then we'll go to Dr. Chapel next.
I think we're trying to do that right now as we go through the priority groups. So one of the things that we've been doing is going to these senior centers that are specifically in the communities that we're trying to target. So next week, I'm actually going to be going back to Doolittle Community Center, which is in the historic West Side. And we, in particular, we're targeting our communities of color and our African-American population. And I'll tell you, like, coming away from doing that clinic, it really, filled my heart with so much joy. I had a woman who was 91 years old, who was originally from the Caribbean, and she just was the sweetest thing. And her granddaughter brought her. And I was just thinking, if her granddaughter hadn't taken the time to make that appointment for her online, bring her there and actually sit with her during the observation period, in addition to making her second dose appointment, right? So we also made second dose appointments for all those people as well. I don't know how that person would have gotten through the process. So kind of going back to what I said before, like, let's adopt somebody who's a vulnerable person, right? We're capable, we're young, we're able, we're nimble. Let's get these people to get vaccinated, even if it's not our turn, right? So I know we addressed sort of the anxiety around getting the vaccine, but we didn't talk about the anxiety about not being able to get the vaccine. So when people were starting to get vaccinated and posting their pictures, I had a serious case of FOMO. So I'm not even gonna lie, that was a big deal. And it was a big deal for us healthcare workers too, because even though I'm a healthcare worker and I'm frontline, I don't work in a hospital. And so I had to wait. I waited, I just barely this past weekend was fully immunized because I didn't get my first dose until January 9th. So, we got to address both sides. So there are people who really want this vaccine and don't have access. So we need to be reaching out to community health workers, faith leaders, people in these communities to try to shepherd people through the process. Even if we're not eligible ourselves, we need to do a better job of vetting these other people through the process.
Wonderful. Absolutely agree. Thank you for sharing that. For our audience that's on Facebook Live, please share this. People need to hear this, and the way that this information gets out is by you sharing and liking and commenting. So please share this broadcast. Dr. Chapel, same question.
As usual, I'm trying to follow up after Dr. Madison here, who routinely hits it out of the park. When we're talking about being able to shepherd others, even if we ourselves are not maybe up next in line, that to me is the entirety of it. This entire pandemic, I've attempted to approach this from like a community standpoint. How can I protect others in the community? Sometimes by protecting myself, wearing a mask, social distancing, things like that. If there are people in your family, if there are people that you know in your neighborhood asking, are you okay? How can I help you with with the vaccine process? Signing up was kind of difficult. I too didn't get vaccinated until early January, and that felt late in the game. So I can empathize more than I'd like to say with that FOMO that you were speaking about. The piece for me is, who can you reach out to today? How else can I do my job in the community? And my job is to help one another. And am I able to maybe use some of my privilege? Do you have internet access? You can use mine, or here's the link. Things like that. Being able to send all of those pieces out and just reach out to people to see if they need the help.
Thank you. Dr. Olea, would you answer the same question?
I'm sorry, can you hear me?
Yes, you're coming through.
Sorry, I'm having some connectivity issues very clearly today. But yes, thus far, like, the question's really been knocked out of the park. I feel like most aspects of it has been touched on in terms of distribution and community engagement, and really just holding ourselves accountable. Earlier when I spoke, I really spoke to being open and honest about our experiences with the vaccine when we're speaking to our loved ones, educating our loved ones, to providing soft challenges to that misinformation, and being willing to engage in a dialogue and challenge it with facts. And I think in that would absolutely increase our loved ones' willingness to get this vaccine and to beat the pandemic.
Wonderful, thank you. And I agree, we've had a lot of really insightful perspectives on this. So thank you for adding to what we'll call the gumbo for this answer. Dr. Labus, I'd like for you to answer next, and any additional perhaps insight from your perspective you could offer.
So I'm not a provider, so I come at this from a little different angle. I try to look at the data and understand what's going on. And you'll see maps in the newspaper and on the websites, and everybody thinks they understand what that data means. And most of the time, even the people writing the stories are completely wrong. And so that's one of the challenges with this, is people look at it and say, oh, I see this difference right here. This zip code has the most cases. Well, yes, but it also has the most people. So that doesn't really tell me that much about what's going on. And so the data can be misleading. And sometimes you'll even see disparities, and those are probably going to be underrepresented, because if you think about how people get tested and treated for this, the people at the highest end of the economic spectrum are the ones who have the best access to healthcare. And so it's going to make it look like they have greater rates of disease than they really do. We just do a better job finding it in some populations. So I think it's been a challenge to get data that really shows us exactly what's going on. But at the same time, I kind of wonder if we need data at all, because it's not like I would expect that populations that have been marginalized for decades are all of a sudden going to have better health outcomes than the rest of the population. If you tell me there's a brand new disease, I can tell you before it's even hit our population who is most likely to be affected by it, who's going to have the greatest challenge with receiving care and getting the treatment and the vaccines and all those sort of things. So why not just focus on some of those things very early on and say, these are the populations that have been historically marginalized and have the greatest problems, and vaccinate them and focus on them right away. And the worst thing that happens is, yes, they did have a better time with the disease, and we actually gave them an advantage for once. But what's likely to happen is we're talking about populations that are marginalized, and they're going to continue to be marginalized. And we know who those people are. And as soon as we have enough vaccine, those are the people that we should go out and start focusing on, because they're the ones having the worst impacts from everything related to COVID, whether it's medical or economic or just anything. Every single aspect of COVID hits the same populations the worst. And we can focus on them next as we get enough vaccine to get out of just these few government clinics that we've been able to do so far.
If we were in person, that would be what we call a mic drop moment. So thank you so much for that. I want to thank our sponsors, and Dr. Biazzo, you are coming up, but I do want to thank the sponsors of the event: the Nevada Minority Health and Equity Coalition, UNLV School of Public Health, Nevada Office of Minority Health and Equity, the Nevada Commission on Minority Affairs, UNLV Center for Health Disparities Research, and Dreamsicle Kids Foundation. Thank you for your support of this ongoing webinar series. And with that, Dr. Biazzo, I want to give you the last words.
Oh, thank you very much. Well, I'm going to stress a couple of things here, and that is, it might be some time before some of our community gets vaccinated. And it's so important to remember to continue to do the right thing until then, hand washing, social distancing, like it's been said before. But please make sure to keep your health on the up and up as well. So many people during the pandemic have had a hard time accessing the medical community, right? To take care of their hypertension, their diabetes, their HIV care. Please make sure one way or another you get to your facility that you go to and you get that health care that you need until you get that vaccination. And even after vaccination, it's so important for us to continue to do those things to protect those that still have not yet been vaccinated, to give them a chance to get their vaccine and not get sick before. So I can't stress that enough. And the other thing, we were talking about this just prior to the meeting, is please don't forget to be tested. If you're not feeling well, if you've been around somebody who's ill, if you're in a field where you're dealing with the public a lot and you're not feeling quite right, it's time to get tested. There are so many sites available at UNLV. We offer free rapid testing for our community here, but I know UMC on their website and Southern Nevada Health District on their website, you can get an appointment and get in and get tested. That's become a little bit better. It still must, is a challenge at times. And again, one more thing I'm going to say, we all need to adopt everybody these days. If you know anybody who doesn't have a computer or isn't able to scan a document to put in the registration, because I had issues with that. It's so important to spread the love, basically, look out for each other, help each other out, use whatever privilege you might have to help others, right? So that's my parting words.
Beautifully stated. Thank you for that. And again, thank you all for attending. We are asking for your feedback on today's event. So please take a few minutes to provide your feedback on what you enjoyed about the event and also how we can improve. The survey link is in the chat. As always, remember, you are not just a drop in the ocean, but you are the entire ocean in a drop. What you do matters. So be well, be safe, and most of all, be compassionate. We'll see you on the next webinar.
Lo único que me asusta es cuando no me usas. No me dejes atrás. The only thing that scares me is when you don't wear me. So please don't leave me. Don't leave me behind. Please don't leave me. Wear a mask every time. Please don't leave me. You're breaking my heart. I know wearing me is tough. Wear a mask. The virus is really rough. Wash your hands. Please don't leave me behind. Stay 6 feet apart. Just wear a mask every time. Please don't leave me behind. No me dejes. Sanitize. Please don't leave me. Wear a mask every time. Please don't leave me. Let's all do our